Hey, what's up guys? It's Matt. Sorry I haven't done a video in a week or so. Just a lot going on, you know, prepping for the start of class in a little over a month, as well as some other stuff. So just want to do a quick video this morning. I decided I want to talk about the tattoos and piercing policies that a lot of schools and ultimately a lot of your employers, be it clinics or hospitals or whatever, are likely to enforce. So I kind of briefly talked about this a little bit in my orientation video that we mentioned it. So things like these earrings here. So one of our instructors basically had mentioned that, you know, he noticed a lot of us, our orientation was casual, so everybody was kind of, you know, t-shirts, jeans, kind of sit up, and a lot of us had our tattoos showing. I was front and center, so he had mentioned some people with earrings like this may need to take them out. Now, things like piercings, a point that's brought up and it's hard to argue is in a job like respiratory therapy, you are climbing around behind patients, you're dealing with a lot of different tubing and apparatus, masks and stuff. Things like this that stick out, absolutely reasonable to believe that that could get caught on something, cause injury to you, hurt equipment, cause injury to a patient. So there's not really much arguing that something like this wouldn't be deemed appropriate, and the fact that they kind of preach this uniformity, so regardless whether you're in class or clinicals or lab, that they kind of maintain the same standards there. So not a big deal. Like I said, I have some lower profile studs I can put in. These are only 14s. I can sometimes squeeze a 12 gauge in, so that's not that big of a deal. But the big one for me recently has been tattoos. So I have tattoos. They go all the way up here. I also have some small ones on my arms. Can definitely cause problems. A lot of hospitals definitely have like a no tattoo, or, you know, subtle. It needs to be able to be covered. A lot of employers in general will have policies that state things like can't be extreme or obscene. Well, obscene's obvious, but extreme, what does that mean? That can be defined as anything that's visible. As far as it seems like a lot of HR offices are concerned. Keep in mind, a lot of the individuals you may be taking care of in a hospital are older. Older generations aren't necessarily as accepting. Not saying that all of them are, but again, it's rules are rules. So it's one of those things that you know, you need to abide by. There's no sense in complaining about it too much. I've been having to cover my tattoos since probably 2009. So then, options for covering tattoos. So like I said, piercings, you can switch them out, you can take them out, that's not a big deal. Covering tattoos. Now, it's easy enough to cover a tattoo, you know, with some sort of an undergarment. However, one thing I've realized recently, in a prior job, I used to wear long sleeve Under Armour. It's just the compression tight, you know, usually black or gray, anything that hid the tattoos. Comfortable to wear. Arizona's pretty hot, so it was nice and cool. However, I did try my scrub top on with Under Armour. It looks kind of weird. So it's like you're wearing this weird skin suit underneath these bigger baggy scrubs. So for my birthday, my wife actually got me a few just Hanes small size, kind of a tighter fitting long sleeve tees. I do have to wear seal blue scrubs, so she got me one set of white and one set of like a kind of a gray. Reading up on that in terms of style or what looks good together in terms of colors, complementary looking things. The whites, heather grays, and some darker grays or charcoals may be okay. You may look weird, for me anyway, if you wear something really contrasting to that really light blue, like black. Other options I found is there's companies that do med sleeves, which are kind of like the athletic sleeves you might see basketball players wear. Same concept as Under Armour in terms of the compression stuff, except it's just the sleeve for the arm that goes up to the cuff. So you can wear whatever t-shirt or type of shirt you want underneath, but you're still covering your arms. So those are kind of the only two options I've come across. I saw eBay and Amazon have some like super cheap kind of off-brand ones that you can get like $1.50 a piece. I think the actual Med Sleeve brand ones were running right around $8 to $10 a set, from what I looked at, like allheart.com and a few other websites. So if you have any suggestions for or advice for covering tattoos, what works for you or what you think would work well, definitely let me know. Leave a comment, like the video, guys. I'm still here, I'm still doing videos. I'm here for the long run for all of our RT guys and gals out there. And again, some of these videos may be pertinent, may relate to anyone entering a health-related profession where you may have similar standards you have to meet. But definitely, guys, thanks for watching, and I'll be doing another video here in just a little while. Just finding time to sit down in front of the camera. But have a great day, guys, and I will talk to you guys soon. Bye.